Welcome to another Budget 2020 program. I am Stacey Carmichael, and today I'm joined by the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's a pleasure having you in the program today.
Thank you for having me.
Okay, now Budget 2020, $330 billion. Before we get into the health sector, which we know you have responsibility over, some brief comments on the overall budget and the measures in how that will relieve Guyanese at this time.
I think the budget is a very good one. The budget actually took into consideration the challenges and circumstances which we are currently facing. And as you know, we have challenges with COVID-19, we have challenges with businesses facing difficulty, we have challenges with people not getting jobs and so forth. So this budget seeks to be able to help various sectors that have been facing various challenges, and at the same time bring relief to vulnerable people across this country. So I think in a very short time, we'll be able to achieve that once we implement the measures.
Thank you very much, Minister. Now for the health sector, we've seen a lot being done for health over the short space of time that the government has been in office. But one of the main things that stood out from the budget, the $150 million support for the frontline workers. Tell us how that will assist in that program and how, you know, in terms of our medical officers, nurses, doctors.
Well, that's one component of what we're doing. Mm-hmm. But you know, since March, a number of these persons working in health have been at the forefront of the COVID-19 fight. And what the government is seeking to do is to ensure that they get some amount of risk allowance for the work that they've been putting in. Because every day that they go out and they go to their jobs, it's a possibility, if you don't take the relevant precautions, that you can get infected. And while we know that's their job, we want to make sure that they're able to get a risk allowance. So the $150 million is going to help to give those workers who are at the front line, who are fighting this day in, day out, that risk allowance. And I think it's well deserved.
Thank you. And could you give us an idea of what are some of the programs that will be implemented going forward in the health sector that will see further development, of course, taking into consideration that we are currently in a pandemic?
Well, the ministry, how the ministry is structured, we have 7 major areas. So the first one being the ministry's administration, where we look at the head office and the functions of that office. And then a very important program that we have in the ministry is called disease control. Under that program, we can broadly categorize it into 2 major areas. And that would be infectious diseases and non-infectious diseases. On the infectious diseases, we're looking at things like malaria, filaria, TB, HIV, and so forth. And when we talk about non-infectious diseases, we are looking at diseases, what we might term chronic non-communicable diseases. And under that category, we focus our attention on things like hypertension, cardiovascular diseases, cancers, and so forth. We also have started looking more in depth at mental health, and that would fall under this component as well, or this particular program as well. Mm-hmm. Then we have another program that is called family health. And one of the approaches, we haven't been able to do that in this particular budget, but in future, one of the approaches that we would like to see is what we call a life cycle approach. So from the time the child is born and every phase of life's development, we want to be able to provide adequate health tracking, so to speak, provide the health services to match that age group. So we'll have services at the level of the infant, under 5, and then as you grow into adolescence, to provide adolescent health services. As you move from adolescence into adulthood, to be able to provide specific services for adults, and then of course older persons. The adults also we want to differentiate and to be able to provide more services in terms of men's health and women's health. And we know the health-seeking behavior of men and women have been quite different. Men tend not to come to the health centers, and therefore, when they do come to the health centers or hospitals, at that point they're more sick. If they start taking preventative measures, then we can catch some of the diseases or disease processes at an earlier stage. So we'll, in a sense, this might be the beginning, but in the future budgets, we are going to rearrange that whole section or division of the ministry to be able to capture this continuum of life from the time a child is born right up to when somebody gets into old age. So that's one of the things that we'll be looking at. Under this particular program, however, as it is right now, that's where we focus a lot of our attention on children. So we have our immunization programs, for example. We have expanded the amounts of vaccines that we offer to children. We look specifically at nutrition in the child, and more particularly, we have programs to enhance exclusive breastfeeding. Because one of the things that we want to promote more is for that child to be exclusively breastfed for 6 months. As it is now, the rates are pretty low, and we think we can improve that because a lot of the studies that were done have shown that if a child is exclusively breastfed, that child is much healthier. So we want to promote those types of programs. In addition to the three that I mentioned, we also have programs that would be more clinical and regional health services. What that looks at is the programs that we have in every region of this country, and we would look at the services we are providing at the level of a regional hospital, a district hospital, health centers in that region, and of course in some of those regions we have health posts. And so what are the types of services that we are offering? How extensive is that service? What are the package that we can offer to people in those areas, and how we can improve it? Now, one of the things that we know is that the morbidity profile, or the things that make people sick in various regions differ. And so our services in every region would have to be specific to that particular region. So for example, in a hinterland community, malaria might be more of a problem in that particular community versus what we are facing maybe in Region 4. So our services would have to take into consideration the specificity of the region. And so through this program, or this component of the program, that's one of the ways that we have been dealing with this. We also have another component of the ministry that deals with health education. And we have a number of programs that the Ministry of Health would run to train Guyanese to take up jobs and careers in the health sector, and also to look at more public health types of matters. So that's another area that we have in the ministry. And then lastly, we also focus our attention on persons with disability and offer varying programs to that community. And also we have extensive program in terms of rehabilitation. So persons who might have had a stroke, for example, we want them to assist them in recovery. So we provide physiotherapy services and so forth. So under this program, we are able to do that. We also have another program called Standards and Technical Services, where we are able to review hospitals and health centers and to ensure that they're meeting minimum quality standards. under that program as well, we will review pharmacies, we will review blood banks, and to make sure that they're meeting certain requirements. And of course, with blood banks, we are looking at our transfusion services. So we have our hands filled with the kinds of things that we do, but these are broadly the areas of health that we operate in.
Thank you very much, Minister. As it relates to another measure in budget 2020, the removal of the 25% corporate tax on health, private health, and VAT on medical supplies. How will that help in the development of the sector, private and public?
Well, the thing is that while most of the health services have been produced in the public sector, we always believe that this is a shared responsibility. A lot of people are not able to access private health care because it's not affordable. And therefore, one of the things that these measures would do is to make private health care affordable. And once we can do that, then people would have a choice. So they can choose to come to the public sector, or they can choose to go to the private sector. So this measure is about giving people choices and also to make it affordable for persons to access health care. We really believe that this is going to make a difference, and it's also going to help the private sector to expand, because monies that would have otherwise gone into taxes, they can now reinvest that money into their healthcare services and business and so forth. So we really believe that this is going to make a big difference to the private sector. And of course, patients across Guyana would benefit from this measure.
And the removal of VAT on the medical supplies, that aspect of it?
Well, that one was something, you know, that we were fighting for when we were in opposition. And I remember when the last government first tried to introduce this particular measure, that we had a very robust debate about it. And we were hoping that they would have removed it, because this measure has actually placed a lot of burden on the average Guyanese. And therefore, by removing this, we feel that we will bring relief to every single Guyanese that normally consume various medication and things like that. So this is really something that would help people, and we really want to see this implemented very quickly. It's something that we've been calling for, and I'm extremely happy that this particular measure is in this budget.
Thank you very much, Minister. Now, we cannot do a budget 2020 program without mentioning COVID-19 and the response by the Ministry of Health. How would the new funds help in boosting that response to, the pandemic?
Well, a number of things are happening, because not only under the Ministry of Health do we have funding for COVID-19, because COVID-19 is impacting us in many, many ways. For health in particular, we have set aside monies to be able to bring into operation the Ocean View Hospital. As you know, we have had several challenges with that facility. Although $1.6 billion was spent on the facility, there's still a number of defects and deficiency with the facility. As of today, while we have patients in that facility, we're still having challenges with the plumbing and a whole set of other defects that would have been accepted. Now, we are trying to change that. So the funding that we have received is going to help us to operationalize other sections of the hospital. We want to bring in the 197 beds that the hospital was built to have. We have already purchased more than 100 and something beds, and we have put them in there. But a section of that facility would deal with ICU and ICU care, patients who are critical. That section is not functioning because there's nothing there. What is even more horrifying, they did not even put in the lines for oxygen and stuff like that. So we have to redo that whole area to make sure that these things are adequate, meet the kinds of standards. And so some of this money that we have now received in the budget would go to fix that particular area. The hospital itself also, there's a section that where we are going to put in some diagnostic tools like x-rays and so forth. Those machines have not been installed. We have acquired them. I've seen the crates for one of them. But when you look at what was paid for, this was supposedly already paid for and should have been installed. So now we are going to try to make sure that we have that installed. There's also another section that we should have an operating theater. That, of course, nothing is there. It's just an empty room, and we are going to fix that as well. So with the funding that we have just received from this budget, we are going to operationalize other sections of that hospital and put it into use. I'm not sure, but I think at some point we might even need more money than what it is right now, but we'll see. We'll start by using this and put various components in place, and as we roll this out, we'll be in a better position to advise the government on what else is needed. So that's one thing, and that is to create capacity to be able to work with more patients if we're getting a surge of patients. In addition to that, however, we also have to provide for these patients in terms of medicines and other things that they would need. So the component that deals with drugs and medical supplies, we have received additional resources to be able to buy adequate drugs and medical supplies. Now, one of the new things that we are buying, which was never on our inventory because one, it wasn't available to purchase on the global market, is remdesivir. That's a very costly drug that is used in the US for the treatment of COVID-19 patients. We have been able to acquire this medicine out of India, and the company that is manufacturing this particular drug in India was licensed by Gilead to be able to produce this generic version. So we are getting it at a cheaper cost than what it's available in the US, and we are providing that to our critical patients. So that's an additional cost because this was something that the ministry have never done before. It's new, and therefore we want to make sure that whatever medicines can help our critical patients, that we have it in country. So that's something that we'll be doing. Equipment, we have been over the last month or so trying to source all the necessary equipment to provide for our ICUs and so forth. And this new ICU that we're going to develop at Ocean View, that too, we are trying to get the equipment for that. Other ICUs, because right now we don't have infectious disease ICUs in the regional hospitals. And so our objective is to make sure that in every region, those regional hospitals would have their own ICUs. So that's something that we'll be funding. Some of it from this budget, and we have been working to get other sources of funding to be able to provide for that. So I think this budget in particular, we have actually got a lot of the resources that we need to make sure that all the things that we require in health to be able to respond, that we have it. Another, I think, $1.5 billion were provided to us to buy PPEs. And so we'll be utilizing that to ensure that the persons who are working on the front line are well taken care of, they have protective equipment and so forth. So I think in this regard, we have prioritize some of our spending to make sure that the immediate challenge that is confronting us, that we have all the necessary tools at our disposal to be able to fight this deadly disease. So I'm extremely grateful, happy to be able to have these resources so that the doctors and the people working in the system can utilize it for the benefit of patients.
Thank you, Minister. Now, in the area of testing, I know that we've been doing a lot of testing. What are some of the measures being put in place to ensure that we continue that test to get, a bigger picture of what is going on in the country? Of course, we expect more testing to take place. Could we get like a status update on that process?
Well, a couple of things. One, everybody know our efforts at the National Public Health Reference Lab. So we're expanding that. We want to have 3 PCR machines working simultaneously. We want to work faster, so we have ordered a special machine that is going to expedite the processing of these samples. That machine has already been paid for. That would cost close to 52 million Guyana dollars. So we have paid for it. It should be on its way coming to help us to expedite this process. So in terms of PCR, in a very short period, we should have an additional capacity to be able to work faster and to do more. However, even with the challenges that we have now, we have put alternative arrangements in place, looking at other places where we can send those samples, so whether it's in Brazil or send them out to the United States, send them to Trinidad. So we have created some linkages that would allow us, if we have excess samples that we need to process quickly, to be able to send them to these other laboratories. We are hoping that we don't have to do that, but if it is that we must, then we are going to do that. So that's one avenue. We are also exploring right now the use of point-of-care machine. So they have high levels of accuracy. They're faster, between 15 to 45 minutes for a test. One of the challenges that we were having was not being able to get enough of the test kits. We are remedying that now. We have about 1,000 and something test kits that are, well, cassettes as they call them, that are coming in. And so once those are in, we can deploy those machines more to the outlying area to reduce this challenge of sending that sample from, say, a Region 9 to Georgetown, then it's processed and then results go back. So in a short time, I'm hoping that we have those machines in Guyana already, but what we don't have is the cartridges that we have to use. And so as soon as those cartridges come, we are going to train people from the outlying area to use the machine and then deploy this machine out to those regions. We also have an additional 2 machine that is under a special program that we will be getting in, and also we have under that program another $47,000 US to buy the cartridges. So I think in terms of point of care, you'll see in another few weeks or so that we'll be able to shift from PCR to be able to still test for the antigen, the virus, but using a point-of-care machine, a machine that would be right at the clinic where when a patient comes, if they need to get a test, we are able to do that test right away and in 15 to 45 minutes be able to get their results, right? So we're working on that. There are also other opportunities that are coming up with diagnostics of COVID, and that is they have some strips that are becoming available. And these are not the antibody strips. These are antigen strips that are now being utilized. They have varying levels of accuracy, and that is something that we are right now analyzing. We have been in talks with the Pan American Health Organization that has proposed, I think, 2 specific types of strips to us. And our technical group is meeting, and once they concur, we are going to be purchasing some of this through the Pan American Health Organization. So in terms of testing, we have been very dynamic in what we're doing.
Yes, thank you very much, Minister, for that. Also, in the area of training, I know, of course, we're doing some training as it relates to COVID. Could we do that in two parts? We speak about training in terms of COVID and overall training, what we can look forward to in the health sector.
So we do a lot of training in the ministry, right? COVID-specific training, we assess the needs of our doctors and other medical personnel, and we design programs to remedy some of those deficiencies, if you like. So one, we came up with clinical standards that we want everybody who's treating a COVID patient should understand, know the medications that they should use, what should be used at the first phase of the disease, second phase, so forth. Those protocols, we have developed them, and then we train our doctors how to utilize them so that the standard of care is across the board. We have also looked at one of the deficiencies that we had in the system was people were not getting or didn't know how to use a ventilator, and therefore we have designed a program now how to use a ventilator, what you need to do, and they're also going to get a practical component to that training, meaning they'll have to come down to Georgetown Hospital where they'll go through the practical aspect. So that's COVID training, and we'll continue to develop them as we go. But the ministry itself, because as I said, one of the programs that we have in the ministry deals specifically with training, where we are looking at medexes, dentexes. Medexes are like a doctor's assistant. They're out there, they work. They're a little bit higher than a nurse, but they're trained to dispense and so forth and to do certain basic procedures. That type of training is going to continue because we require more medexes. We have other categories like nursing assistants, technician assistants. So there are a whole set of categories that we do training for, and this has been ongoing. The ministry also, we have a number of nursing schools. So we have a nursing school in Georgetown, we have one in Linden, we have one in New Amsterdam, and at each of these nursing schools, we provide various types of nursing training. So whether it's at the general nursing level to more specialized areas such as anesthesiology, mental health, and so forth. So all these are different types of training program that we do on an ongoing basis. We also have, in collaboration with the University of Guyana, the Georgetown Public Hospital, we would have training programs for undergraduate doctors because they have to come and do their rotation and internship at the hospital, which is a teaching hospital as well. And very soon, we will be collaborating with the Yusuf Prasad Foundation and opening a 3-story building that would be used for undergraduate and postgraduate training of doctors. So very soon we'll be opening that facility, and that would, of course, boost the quality of medical education that we'll be providing in Guyana. So in terms of training, there are lots of training that is being done by the ministry, and some of them are certificate level, others are training on the job training, and accredited in most cases by the Guyana Medical Council or the Nursing Council or so forth. The relevant body would accredit these programs.
And what about upgrades to hospitals? I know there's consideration for that as well in the budget for the upgrades of several hospitals. In addition to those hospitals I highlighted, what about the other regional hospitals, health centers?
So right off, we have a couple of programs that we're doing. So one of the initiatives that we have is called the Smart Hospital Initiative. That is being funded by the UK or DFID, and that is being done in collaboration with the Pan American Health Organization, who is overseeing the retrofitting of a number of existing facilities. So the first one that the one that we have started with is the Diamond Hospital in the East Bank. So that is going to be retrofitted now for a couple of reasons. One, we want to create a better flow of patients within the facility to make it more efficient and so forth. Secondly, we want the structure of the hospital itself to meet certain integrity tests so that in case of natural disasters and so it can withstand those types of disasters. Thirdly, we want to make sure that these hospitals are utilizing technology that are more appropriate, would require less energy, and so when we are retrofitting the equipment, we are ensuring that we have equipment that is not going to require too much energy. Fourthly, we are going to be utilizing solar power at these facilities. Now, we cannot depend solely on solar power, but during the day and for a large portion of the night, we would have a battery bank that can take care of a large portion of our power needs. So these hospitals are going to be modern, they're going to be retrofitted with the latest equipment, and they're going to provide a more efficient service. That's the intention. And it would serve as a model for us to do future facilities or existing facilities that we need to retrofit. So we're starting with Diamond. We also have hospitals such as Lenora that would benefit from this program. We have Letem, we have Paramakatoy, and we have Magaruma. So these are the 5 hospitals that would initially where we would be using this smart hospital concept. Now, this is not something novel, because this methodology or this type of hospital that we're talking about, this was done in Europe and other countries, and we have seen the benefits from it. During the initial phases of this particular project, we have had consultants here who would have assessed other health facilities that we have. And so when we are going to do the infrastructure upgrade for those facilities, we want to follow this particular methodology of making them into a smart hospital. So we're starting with this 5. In addition to this 5, we have also earmarked major infrastructural works for 3 other hospitals. And these include the West Demerara Hospital, Soddy Hospital, and the Bartica Hospital. This is a $17.5 million project that is going to be provided by the Indian government. We had initially started these discussions when we were in government the last time, but over the years there have been a lot of talk, but nothing has happened to see this project materialize. But already His Excellency would have had discussions with the Indian High Commissioner here. I was present at some of those discussions, and I know that this project is now on the move. So very shortly, you will see things being done to make sure that these hospitals are being built and so forth. Now, other infrastructure things that we are looking at, the Ministry of Health, we have a building that is there and that has been under construction for many, many years. So in this particular budget, we have set aside some money to continue that exercise. But we want to, in the next couple of budgets, to bring that to a close. And so there were some additional design work and electrical work that had to be done. So that is in this particular budget. We also have some other infrastructural works that we are doing. There are a number of areas where we will be building maternity homes, and that is being done through an IDB project where the government of Guyana took a loan from the IDB, and through that loan we want to ensure that mothers, when they come to our facility to give birth, that they are able to do so in a safe environment. So we'll be building a number of maternity homes And we have allocated some of the monies in this particular budget. You'll see very shortly we'll have the Lethem maternity home. We'll start the construction of that, and we are hoping to do a few on the East Coast as well. There are about 2 or 3 that have already been completed, and we'll be opening those as well. In addition to that, we have received funding from Gavi, and we'll be doing 2 specific health centers at Iterengbang and another place up in Region 1, where we'll be working on those health centers to expand the services that is being provided at these health centers. In the regional component of this current budget, there are a number of regional projects that would be there. We also have, for Region 3, for example, something that has been a sore point for a lot of the residents in Leg 1, for example. They have had many promises that they would get an X-ray for their district hospital. In fact, an X-ray machine was bought but was never installed because the conditions, the room would have to meet certain minimum requirements, and that was not thought about. So you have equipment, but you don't have the facility to make sure that this happens. In this budget, we have ensured that monies are there to provide for that, and once we are able to retrofit that room, the people there would be able to get their X-ray up and running. A similar situation exists in Parika, and that also we are trying to fix. Despite many promises, people in New Amsterdam, for example, the hospital at New Amsterdam, they're still having a number of challenges with diagnostic facilities. That too, we have started to fix that, and we are going to complete it because we now have resources to make sure that these things are fixed and up and running. So it's an ongoing process. This budget also allows us to buy a number of important pieces of equipment, X-rays being one of them, because a lot of our district and regional hospitals should have proper X-ray units. They should have ultrasound machines, they should, but many of them don't. So we have in our minds exactly what type of services we want to offer at our regional and district hospitals. And if we are going to be able to offer those services, it would require that we have these diagnostic pieces of equipment that is available to provide the service. And not just the equipment, but we have the requisite personnel to be able to operate the equipment. In other cases, we have had some other challenges. So for example, when the equipment is available, the personnel is not available because some of these persons, they work from 8 to 4. And health emergencies is not an 8 to 4 thing. Okay. You have to get a 24-hour service. So that is something that we are looking at to ensure that we are able to provide 24-hour services at the facilities such as the regional hospital. So there are lots of stuff that we are fixing, and we have different teams of people working on different things, and I'm very hopeful that we can start seeing a turnaround very quickly.
Thank you, Minister. Now, my other question would be, we've been collaborating with a number of agencies over the years in terms of health, PAHO, WHO, among others. What are some of the projects going forward? Would we see some more collaboration with these international organizations in terms of building our health sector, developing it to the level we want to see it?
So we have very strong collaboration with PAHO, and we have been doing quite a number of things with PAHO, ranging from immunization, technical training, in almost all the areas that you can think about. So there are a number of things that we have been doing. We have also been on the PAHO WHO board, and right now Guyana holds a seat on the executive board of the WHO. So over the last couple of weeks, I've had the opportunity of sitting in on some of those meetings. I've had already about 2 meetings with the PAHO leadership, and that is at the Director General level and so forth. and participated in a meeting at the WHO level. We have a number of other meetings that are coming up, and at these levels we are able to do quite a number of plans, look at programs that can benefit the region generally, and then see how, and as a country, we are able to fit into a number of these things. So I think that strong collaboration that we have with PAHO, that's going to continue. We are also cultivating relationships with some other agencies. We had strong programs, for example, with the IDB in the past, but these are loan agencies. We are going to continue to do that because right now we are in negotiations with them for specific health sector related programs. In the past, we've had arrangements with the World Bank. In one of my earlier things that I did in my career, I was managing a program for the World Bank dealing with HIV and AIDS. We have been working with the World Bank to access funding for COVID-19. They seems quite receptive, and hopefully we'll be able to get those funds. So apart from the UN types of organization, we have also been working with these lending institutions to be able to get resources into Guyana. We have had a close collaboration with Gavi, that's the International Vaccine Alliance, and we have been able to get vaccines at reduced cost into Guyana. We are currently working along with Gavi to be able to source at reduced cost a vaccine when it's available for COVID-19. So that's ongoing work that we have with them, and we are hopeful that Guyana would benefit in a substantial way from Gavi. We also have been working with the Global Fund, and the Global Fund has been for many years helping Guyana in the area of malaria, TB, and HIV. And in this instance, apart from those three areas, we are also working with them in the area of COVID because they have released some funds to us to be able to redirect those funds for immediate COVID needs. We have also worked with UNICEF on some other projects, and UNICEF has already done what we call knowledge, attitude, and practices studies. They've done 3 of them, and they've shared those results with us, and so we are designing some programs around them. So we have maybe different groupings of organizations that we're working with, international multilateral organizations, UN types. We have the lending institutions, and we have others that are global organizations that have been involved in health. And so we are collaborating with all of them. In addition to that, we have been reaching out to establish other types of partnerships with universities, especially in the United States and in Canada. And those partnerships, some of them have been in existence for a while. Some of them have gotten dormant, and so we are resuscitating some of them. So, like for example, the University of Vanderbilt has been working with us on our emergency medicine program. They were about to leave Guyana. We are hopeful that we can get them back to continue the work that they have done with EMS in Guyana. And there are others that we'll be talking about a little bit later on. Some of them we are in the process of negotiating and signing on some new technical agreements where a lot of our doctors and technical people can benefit from training through these institutions. So this is an ongoing effort. It's going to be very dynamic, but ultimately what we want to do is to be able to lift the quality of patient care here. And once our clinicians and other healthcare workers have that level of knowledge, then you would see an improvement in that type of care here. So with all the technologies that are around now, it's easier to access knowledge and to utilize that knowledge. And we want to leverage a lot of these things so that our healthcare workers can benefit from it and pass that on in terms of patient care. So I think it's an exciting time. And again, I'm happy that many of the things that we want to do in the sector, we are getting the resources and support from the president and the government to be able to realize many of these things. And so you would see a different type of health sector unfolding in the next couple of years. It would be a different sector, quite transformational, if you like, because that's our vision for where we want to go.
Talking about vision, Minister Anthony, going forward, what are some of the things you would like to see in the health sector? I mean, not necessarily from this budget, but going forward 2021 and beyond. Longer term goals.
We have our core programs, but we are going to change some of them to get more out of them. Of course, you will have those routine things where we'll have to fix health centers and get more equipment and that sort of thing. But one of the areas that we are working on is to establish a stronger program for training. And we are looking at various collaborators to be able to do that so that the quality of medical education in Guyana would be lifted. So that's one area that we are looking at. Another area is a public-private sector partnership in the area of providing clinical care, and in some cases to provide the enabling environment for the private sector themselves to be able to invest and do more in terms of private sector clinical care. So what we want to do is to create the enabling environment to allow many of these things to grow. Guyana, for a long time, we haven't been involved in a lot of the kinds of research that we can do as a country. And so that's another area where we want to focus our attention to do a lot of research, to have the development of a research institute on various things. So you will see a number of these things coming up in the near future. And of course, there are lots of legislation that we have in the health sector that are very old, and we'll have to change those. So you would see, for us to move into the 21st century, we'll have to change a lot of the legislation that we currently have on the books to bring it in line with what is the modern type of legislation. So things like an ambulance authority, legislation dealing with EMS and so forth, those are things that are going to be new. We have been doing some level of transplant in the country. We don't have any legislation that supports transplant. So if we're going to continue to do these things at scale, then we have to get the legal authority to be able to do that. And there are a number of other areas that we'll be looking at. But again, many of these things, I anticipate that in future budgets we'll be able to integrate it into those budgets. Telehealth, for example, would be another way to go, especially with what is happening in the interior. We need to have that telepresence to support our doctors who are on the ground, our medical personnel who are on the ground. With technology, it can help us to do that. And so that's another area that we want to pay attention to, invest in, and to be able to create a system. You would have also heard that we are looking at a new EMS system, a new patient, electronic patient record. This is something that we have engaged the Indian government on. Some initial discussions have started, but ultimately what we are looking at is to have a national electronic patient system, so that any person who come to any one of our facility, the doctors there, with the permission of that patient, would be able to access the patient's history and so forth. So these are things that are going to enhance the efficiency of our health services, but this is just the beginning. We have lots of plans, lots of things to do, and right now we have a team within the ministry and other friends who are helping us to develop a vision for the health sector from 2020 to 2030. So this is ongoing work. We are doing a review of the plan that came to an end in 2020 and starting to work on a plan for the next 10 years. So these are things that we want to you know, get the population involved. There are lots of people who have their own ideas of how health can be developed, um, you know, and we don't want a system that focuses only at the tertiary level. We must have a system that would bring balance. So we have enough of the tertiary facility, but we must also not ignore the primary care health system, because that's going to be for many people the first interface with our health system. But the quality of primary care, the amount of services that you can access at the primary level, this is what we want to improve. And we want people to get a better package at the primary care level so that they don't have to come to a hospital. You must only come to a hospital if you need hospitalization. All the other types of care, you should be able to get that in the primary care system. So it sounds like a tall order, but I think, you know, we have a lot of good people in the system, a lot of technical people, and I think a lot of people share this vision because everyone would like to see Guyana have a better health system where everybody can feel secure that when they come to one of our facilities, that they are getting the best health care that is available.
Thank you very much, Minister. Now, as we come closer to wrap-up time, just some closing thoughts on Budget 2020, as it says, our plan for prosperity, and just some general closing thoughts on that presentation.
Well, indeed, you know, what we've seen in this budget is perhaps just a trailer into what is going to happen over the next couple of years. It's an introduction of what we're going to be doing. This budget was created in a very short space of time, and you know, while we would have liked to put a lot of things, it's realistic because we have up to the end of the year in which to spend this money that has been allocated. So it's quite realistic, quite practical, and it would start laying that foundation that is necessary for the future budget. So I'm very optimistic. I'm very happy with the allocations that we have received, and we are going to build on this. And I think for many of the other sectors, we can see that this is already laying the foundation for that leap into a more prosperous country. So we're extremely happy with our allocation, and the team at the Ministry of Health is going to make sure that whatever is given to us, that we are able to spend it within the time frame that is given, and of course, to be held accountable for the monies that we have. So what I want people to do is to urge them to participate, help us share their thoughts with us. We are all here to serve the people of this country, and we would really like to have their feedback on things that they feel we should be doing in health in their community. And once we get those feedback, we'll try to incorporate it into future plans and things that the ministry would be rolling out. So again, I think this is the first step in the right direction, and it gives us the kinds of resources that is necessary to ensure that the Guyanese people have good health in this country.
Thank you very much, Minister. And I want to thank you for joining us today on Budget 2020 discussions, and we look forward to interviewing you again. Thank you also to the viewers and listeners. Bye-bye for now.